Croaky here, and I'm with Ray Moynihan, who is an old hand in journalism and healthcare now. So a former Four Corners journalist and journalist throughout the whole Australian industry. You're now an academic at Bond University, and you're at the Choosing Wisely conference here in Melbourne. As somebody with a long time interest in overdiagnosis and over-testing, what's your takeaway from today?
I'm incredibly excited about being here today. I think that the world is changing. The idea that there's a problem of too much medicine is now being taken extremely seriously. Today we've had clinicians, doctors, health professionals, researchers, consumers, policymakers, all talking about this problem of too much medicine, too much testing, too many drugs, too many procedures, and too many diagnostic labels. And not just talking about the problem, but talking very specifically about how to deal with this problem, how to address it. For a long time, I and others have been pointing out this problem, but the really exciting thing is now that it's being taken very seriously, and Choosing Wisely is leading, quite explicitly, leading a social movement.
And did any specific examples of work stand out for you?
Look, I think there's a lot of great work here, but one of the areas that really stood out to me was hospitals or health services. Again, very explicitly saying, we have a problem in our hospital. We're doing too many tests. We're doing too many pathology tests, too many blood tests, too many CT scans, and we want to address that, and we're going to put in place procedures to reduce those. And there was a range of work from around the country today, and clearly health organisations, managers, senior clinicians are taking this very seriously, and so that was very exciting. Possibly one of the most exciting things was seeing the genuine health consumer engagement in this issue, with this issue. And so what we saw emerge here today really was the beginnings of an extremely close collaboration, partnership, if you will, between health consumers, Choosing Wisely, and all the other partners who, I think I'm right in saying, are talking about a very big national awareness-raising campaign about the problem of unnecessary testing and unnecessary treatments. And this is only going to bring a lot of benefits. I don't see a lot of downsides in this. Of course, it has to be managed very well. We have to have good evaluation and strategies in place to make sure we're not doing any harm here. But I think that's all happening.
Now, you also presented a poster that sort of brings together your different interests. Do you want to? Oh no, we've tucked it away, haven't we? What's your work, and particularly in terms of the media coverage in driving? I think we heard a lot about unnecessary interventions.
Describe that? Well, so. Look, a very small point that you may or may not want to check later is, when I was at Four Corners, I was a producer and a researcher, working as a journalist, but I was never an on-air journalist, just to clarify that. But with a background in journalism, in more recent years, I've been developing as a researcher. I did my PhD in the problem of overdiagnosis, and now working as a postdoc, and very successfully and very happily won a NHMRC Early Career Fellowship quite recently. One of the things that I'm doing, among a suite of things, is working with a new PhD student on how to optimize media coverage of medicine to start addressing this problem of overdiagnosis, of too much medicine. And so we have a very bright PhD student starting to work on that. I've also done some work historically on media coverage of medicine, and while there's a lot of great media coverage, there's also a real problem with a lot of medical reporting really being promoting the benefits of new technologies and new treatments, without really investigating their downsides. And I think I'm right in saying that many people are concerned that the media may often be, perhaps even inadvertently, helping to drive a lot of medical excess, unnecessary testing, unnecessary treatment, with its sort of over-enthusiastic promotion of new medicines, new procedures, new tests. Let's take genetics just briefly. Yes, there's going to be great benefits from this new technology, the new genetic testing, genomic testing, but there are enormous potential downsides. And so the way the media responds to this new technology, this new medical science, is critically important.
And that's if we put it in the context of a fake news environment that we're experiencing, and also this week the massive job cuts that we're expecting to see at Fairfax, how do we make sure that there is good coverage of health? And what are the risks if we don't?
Well, that is the topic of Julia Majew's PhD, and that's exactly what she's investigating. And look, you know, we need a suite of strategies in place, and having good, reliable, credible media and journalism is critically important. And so it's incredibly sad to watch these old organisations falling apart with the advent of new technology and the collapse of old business models. But surely there are ways to harness the new technology and all the benefits it might bring to ensure that the public debate about medicine is well informed, is informed by good evidence, and is informed by a kind of a sense of questioning, not just a blind acceptance of whatever the new latest shiny products are.
Do you have, sort of beyond those general instructions, do you have any tips for journalists about what to do? How can they make sure that they don't fall sort of habitually into that?
As it happens, I did write a tip sheet for medical journalists, and that's available online still. And it's a simple tip sheet, and it's very simple. It's about thinking about the benefits as well as the harms of anything you're writing about. It's about thinking about the conflicts of interest of the people that you're interviewing. It's about thinking about whether or not people are trying to exaggerate the importance or size of a disease in order to sell new products. Just some basic tips for people covering medicine and healthcare. And that tip sheet's still available via the Commonwealth Fund, who originally funded that work.
And just with the declining media, the loss of rounds is quite a thing, isn't it?
Yeah, I mean, yes, it is. And look, I look with tremendous sadness watching some of the traditional media outlets withering away, let's face it. And it's very sad, and there is a great value in that old notion of a round. In other words, a journalist who specialised in covering medicine. I mean, the problem traditionally has been, though, that by the time a journalist gets their head around how to cover medicine in a more realistic way and not just fall for all the hype, they move on to another round, to the political round, or they go and write books, or they become an academic.
Yes.
So that is a problem. But I agree that having some sort of specialisation in medical reporting is valuable, without in any way being captured by the medical establishment or the healthcare establishment.
And will this study you're doing, will it look at new models of media reporting beyond the traditionals?
Yes, it may. I'm not really sure. I don't think. I don't know for sure. I don't think I'm really qualified to answer that at this point. I mean, the lot of the work that I'm doing really these days is about this problem of too much medicine, this problem of overdiagnosis of the use of unnecessary diagnostic labels, turning healthy people into patients, and that's the work that I'm doing in terms of how to envisage new, better ways to deliver information in a changing media environment. That's a big question. It needs lots of thought, and I'm sure there are people investigating it. One of the things I'm doing is co-chairing the scientific steering committee for the Preventing Overdiagnosis Conference. And this year, that's in Quebec, Canada. This is the 5th conference. It's been a very successful series. It's a great conference, and it really is about investigating and putting on the table the science of this problem of overdiagnosis or unnecessary diagnosis and the solutions. And so, like Choosing Wisely, it's very much focused on not just documenting the problem, but working out how to address it, how to try and fix it. And so that conference will be taking place in Quebec in August, and it's actually being hosted by the Quebec Medical Association. Can you imagine the Australian Medical Association hosting a conference, an international conference about overdiagnosis?
Well, there's a challenge.
We're not quite there yet. Perhaps in a few years' time. I did notice the AMA were here today at this Choosing Wisely conference, which is a great encouraging sign too. The Quebec Medical Association, representing the doctors of Quebec, has decided that overdiagnosis, that overuse, overtreatment is a major challenge to the health of their patients, a major challenge for the health system. And so in order to reduce harm, in order to make health systems more sustainable, there's a real interest in trying to address overdiagnosis. So that conference will be happening very soon.
One last one on the media is that, do you think these sorts of conferences, and today there was passing reference to it, but the media is not really, is it seen as a stakeholder in these discussions, or is it still, you know, this sort of external thing that you still try and chase down when you've got a few results?
Look, that's a tough question, because I think there's a whole debate about to what extent media should be engaged as a player in these social movements, or to what extent the media is just simply reporting on them. I mean, that's a complex and big discussion. I guess it's disappointing for me that a day like today, when with so much incredible information, so much incredible science, emerging science, such a big issue for Australians, for the healthcare system, for the health of all of us and our loved ones, very little media coverage really arising. Some arising here now. These are the sorts of stories that should be leading the news, not the car crashes, not the fake news coming out of the White House, but this is real news that's incredibly relevant to our health and to the health of the Australian health system. And one thing that I would hope would be that these sorts of initiatives that are addressing the problem of too much medicine will start to get more and more media attention.
Can I put you on the spot and say, if you were here with your journalist hat on back in the day, what story would you have gone away and written?
Well, that is a challenge. I think I would have gone away and written a book.
Yes.
called Too Much Medicine.
Which you did.
And that's what I did 20 years ago when I was involved in much smaller versions of these sorts of meetings. But in terms of today, there are many stories. The overuse of antipsychotics among our elderly with dementia. What a disaster, what a scandal, what a crisis that we are overusing powerful antipsychotic medications on our most vulnerable people. What a disaster that we're overusing CT scans on children. Not to mention antibiotics and all those things that people are familiar with. But among the proceedings today, there's some extraordinary stories about this weird situation we've got ourselves in. All the wonders of medical science have bedazzled us, such that the pendulum has swung way too far. We are using too much of a good thing, and that, well, for me, that's become the biggest story in healthcare. And it's been the biggest story in my life for the past 20 years. But I think it should be a big story in everyone's life. Learning how to protect yourself and your loved ones and the health system as a whole against unnecessary care. It's a huge story, and it's a really exciting story.
Thank you very much, Ray.